Hello, my name is Christopher L. Macy. I work as the Education Coordinator here at HIV Alliance. Our agency, by name, works to help people living with HIV and AIDS. We also have a hepatitis C case management program. Alongside other tests, our agency offers hepatitis C testing for anyone who may need it. This short lesson focuses on two main topics. The first is how hepatitis affects the human body. I'm going to talk about the liver and the signs or symptoms of hepatitis. This portion will also cover exposure to hepatitis, transmission routes, and ways to protect yourself from acquiring the hepatitis C virus. This first portion will make up the majority of what you hear today. The second topic will cover stigma. Talking about stigma and bias regarding medical diagnoses is very important. I believe that misinformation alongside fear can guide stigma. I want you to know the facts well enough to help stop the spreading of misinformation. Now is the time I want to prepare you for this video's content. Here we will talk about sex, needles, and illness. These topics and themes may be uncomfortable for some, and that is completely understandable. Sometimes discomfort is why it can be hard to talk about certain issues. If we don't talk about these sensitive topics, then we may leave ourselves at risk to their consequences. Please keep in mind that education is our first pillar of prevention. At HIV Alliance, we hope to educate our community in order to prevent new infections. Let's start with the word hepatitis. Hepatitis, from its two roots, hepa and itis, just means inflammation of the liver. When I think of HEPA, I think of the HEPA filter that may come in air conditioner units, or vacuum cleaners, or other household filters. The liver works as a filter to the blood which comes from someone's digestive tract. Your liver has many jobs, including the storage of nutrients and vitamins from foods and drinks, to lotions on your skin, and even the air that we breathe. The liver works alongside the gallbladder and pancreas to digest and process foods. Without a properly functioning liver, we as humans would not be able to survive. The most common cause of hepatitis comes from viruses, like the ones we'll talk about in this lesson. The liver can also become inflamed due to toxic damage from the misuse of alcohol or drugs as simple as acetaminophen, a common household pain reliever. Other things that can cause liver damage in hepatitis are bacteria, fungi, and protozoa that are single-celled parasites that feed off of other tissues. The liver sits behind your ribcage, just under your lungs, opposite to your heart, and above the abdomen. It is one of the largest organs in someone's body, and can weigh about 3 pounds all on its own. The liver can manage about 500 different tasks for the human body, and that's pretty incredible. From creating proteins to keeping blood sugar levels under control, the liver works very hard for us. It is considered a non-complaining organ, so it cannot feel pain. The liver also stores vitamins from food and drink, including minerals and iron. The liver manages when those substances are released back into the bloodstream for use by the whole body. The liver also produces bile, a key component which breaks down food in the intestines. The liver can even regenerate and regrow itself. This may sound like some form of science fiction, but some liver transplants work by taking only part of a living donor's working liver and then letting it regenerate itself into a normal size in another person's body. Both portions of that single liver can regrow to a normal functioning size in both the donor and the recipient. The liver does amazing work, and it's important for us to take care of our own livers. Now, my next fun fact about the liver is that it's considered a non-complaining organ. I've already said this part. Non-complaining means that its cells do not have nerves that you physically feel. Imagine poking it. You wouldn't actually feel that poke from the liver itself. Somebody could have serious liver damage and not know about it without being able to recognize the symptoms. The symptoms of hepatitis may look flu-like, and a person may go untested and untreated for hepatitis. Those symptoms look like fatigue or tiredness, dark urine, abdominal pain and a loss of appetite, those flu-like symptoms of fever, chills, nausea, and even as far as jaundice, which is the yellowing of the skin and eyes. These are what a person may feel when the acute onset or infection of a hepatitis virus hits. As I've stated already, these symptoms may be subtle or unseen. In chronic hepatitis cases, where the infection builds slowly, a person can likely not see any of these symptoms either. Let's take this chance to go over the viral hepatitis agents. Now, a virus is an infectious agent that uses a host cell to reproduce and make more of itself. The hepatitis virus infects liver tissue and replicates there. The 5 viruses that cause hepatitis are listed as hepatitis A, B, C, D, and E. These 5 viruses work independently, meaning that one virus will not develop into another form of hepatitis virus, and it is possible to have more than one of these viruses at the same time. In the short term, these viruses lead to cell and tissue damage in the liver. In the long-term effects of hepatitis, those damaged liver cells can lead to scar tissue in the liver, the blockage of the filtering process of the liver, which is called cirrhosis, and possible liver cancer. Let's go over these viruses one at a time. The hepatitis A virus is present within infected feces. It is usually transmitted from person to person through the consumption of contaminated food or water. Certain oral sex practices can spread the Hep A virus from person to person as well. Hepatitis A can have an acute infection where it lasts for a few months and the body can resolve this on its own. There is a vaccine for this virus to protect from acquiring it in the first place. In 2017, there were around 3,000 reported cases of hepatitis A in the United States. And while this may be a large group of individuals, that's a lot smaller than the average of around 30,000 before the vaccine was formed in 1995. Skipping ahead, hepatitis E has the same route of transmission. Hepatitis E can also be transmitted through consuming fecal particles in food. Hep E is more prevalent in places with lesser hygiene standards than the United States. There is also a vaccine for hepatitis E. I'll use this moment to make a reminder that it's important to wash your hands thoroughly before preparing and eating food. The hepatitis B virus is transmitted through infected body fluids, such as blood, semen, and vaginal fluid. Hepatitis B is commonly transmitted from an infected parent to child during childbirth. Another route of transmission for this is the sharing of blood tools. Anything from sharing razors or toothbrushes or sharing injection drug equipment such as syringes and other tools can spread infected blood from person to person. There is a vaccine for hepatitis B. The Hep B virus is dangerous and can lead to serious fibrosis and cirrhosis of the liver. Remember, this is the buildup and scarring of tissue in the liver. Once infected, a person can undergo treatment to suppress the effects of hepatitis B. Commonly used is a medicine that works to suppress HIV cells as well. With the presence of hepatitis B can allow for hepatitis D to infect an individual. Hep D is considered an incomplete virus, so it requires the use of Hep B to assist it. Hepatitis D is not common in the United States. There is no vaccine for hepatitis D, but someone who is vaccinated for hepatitis B can prevent hepatitis D. Hepatitis C is the final hepatitis virus to focus our attention. I will go a bit into more detail on this virus in particular. Now, hepatitis C, or HCV, can only be transmitted from blood-to-blood contact. That being said, it can also be transmitted during sex when blood is present and when there is any tearing or bleeding. HCV was first identified in 1989 by the Center for Disease Control, or CDC. Medicine to treat HCV began in 1991. There is no vaccine yet for HCV, only treatment after a person becomes infected. Since March of 2019, Americans enrolled into Medicaid can receive the cure without having to wait for serious liver damage to set in. Before this rule change, a person would have to wait until the damage was serious enough as seen by a doctor. The CDC estimates that 1% of all Americans live with chronic HCV. This is a very hardy and strong virus. It would take more than a standard household cleaner to kill any HCV cells. Outside of the human body, this virus could survive as long as 3 weeks if not cleaned properly. If infected blood were to hide inside of a syringe needle, the virus could survive as long as 2 months. In medical or dental settings, reusable tools get sterilized in a machine called an autoclave. It applies pressure and heat to incinerate any virus or germs on the surface of those tools. Now, there are 6 distinct genotypes, or genetic strains, of HCV. The first genotype is the most common, and unfortunately the hardest to cure. This strain leads to chronic HCV, meaning that a person may live with this virus for as long as 30 years without knowing. Allowing a virus to damage the liver for that long can lead to serious consequences and permanent scarring to that tissue. The most common issue for those living with chronic or long-term HCV is the constant feeling of tiredness. Up to 4% of people with HCV-related cirrhosis can develop liver cancer. And about 20% of people infected with HCV may be able to fight it off naturally. They can have the virus for about 6 months, and their bodies are able to clear the virus without medical intervention. However, that leaves about 80% of people with the chronic HCV, which would require medical treatment. After exposure, a test can come back positive after 45 days. A doctor may refer someone to a hepatologist or liver specialist to have a biopsy and further testing to assess the degree of damage that may have occurred. Some individuals have a higher risk than others when it comes to hepatitis C. So who is most at risk? Those from the baby boomer generation, born between 1945 and 1965, are at a higher risk. They lived most of their lives in a time when this virus was not tested for in any medical procedure. Anybody who has received a blood transfusion or solid organ transplant before 1992, when testing was reliable, may be at risk as well. Any person on long-term hemodialysis treatment or has received blood clotting factor concentrates before 1992 also. Any person who has snorted or injected illicit drugs and or shared that equipment with others may be at a higher risk. It is recommended that anyone with HIV should also be tested for hepatitis C. And children born to hepatitis C positive mothers may be tested after 18 months to assess their risk. It's important to test for hepatitis C at least once. I'll wrap up this section by reframing the hepatitis C virus in its stages of progression. A person can become infected with HCV from coming in contact with infected blood. Some people are able to fight this off on their own and only deal with the acute infection, but most individuals with HCV are infected with the first genotype, which is the hardest to treat. They may suffer from chronic inflammation of the liver, which can then progress to fibrosis and cirrhosis of the liver tissue. If left untreated, the chronic HCV infection can last for many decades and cause permanent damage to the liver's tissue, including cancer. A person can be tested after 45 days from exposure and then see their doctor regarding treatment. It's important to abstain from drinking alcohol, smoking tobacco, and the overuse of medications like aspirin, ibuprofen, or acetaminophen if positive with hepatitis C, as it can cause extra damage to the liver. Now I'm going to talk about the ways to protect yourself from the hepatitis C virus. Some are simple tips like covering up any open cuts or sores. Here's another reminder not to share any personal care items that may contact blood, like toothbrushes and razors. If someone is engaging in sexual activity, to use protection like condoms to protect the skin and proper lubrication to reduce any chance of tearing or bleeding. It's important to use the right kind of condoms and lube. Latex and synthetic condoms are best. Do not use any lambskin or skin-based condoms. Their large pores can allow for sexually transmitted infections to pass through. The safest lubrication to use is either water-based or silicone-based. Do not use oil-based lubes as they can damage condom material and possibly irritate the skin further. Finally, never share needles or syringes. Blood-to-blood contact is dangerous and is the fastest route to sharing infections of many kinds, including hepatitis C. Now, you've heard me talk a lot about the functions of the liver and hepatitis. You've heard about 5 different hepatitis viruses, and we focused on how hepatitis C is spread. I will take a moment to talk about in which ways HCV is not spread, and I will talk about stigma. Hepatitis C, as I've said, is spread from contact with infected blood. That means you cannot get HCV from simply kissing someone who has it, or from casual contact such as holding their hand or living and working with someone living with HCV. Though the virus can survive for as long as 3 weeks on a surface or 2 months secured inside of a syringe, this is why it's important to clean up after any blood spills and to not share needles. Hepatitis C is a curable illness and can be treated by a medical regime. Now, stigma is a real and powerful issue in our world today. Stigma is defined as a mark of disgrace associated with a particular circumstance. In our American culture, we may place stigma on those living with HCV. It's important to bring this up now. There is nothing disgraceful about illness. While it's understandable to want to protect yourself from illnesses, if we understand how to avoid illness, we can remove judgment and stigma from those that live with these illnesses. I hope this video has been very helpful in understanding hepatitis. You can reach out to HIV Alliance for any more information or support with testing at any time. Thank you.